Welcome to TFC Transplant Talk, where you'll find the most up-to-date information on topics that matter most to you and your loved ones. Join us in our engaging recorded interview series between transplant healthcare professionals and families living the transplant journey. We are your partners in transplant information, improving the lives of both the recipient and everyone around them.
But it's been a frightening, but also, you know, interesting time, and a time where I think we're learning a lot about not only, medicine and viruses, but also about the interaction between our communities and our viruses, because we haven't really had to deal with that to this scale before. So in my role, I'm getting a lot of questions from patients and from parents in the different places, that I've worked about COVID, and a lot of really practical questions about how to deal with this novel coronavirus and what it means for somebody's life. And unfortunately, because this is a new virus and a new disease, and we're really only months into into a brand new disease for us, that we are still learning, and we still don't have all the information that we need. And that can be very confusing and very frustrating for people sometimes. And so my general approach for other diseases, as well as for this one, is really just to try to be practical and to try to be smart about things, and understand what do we know, and how can we deal with it based on the things that we know, and how can we adapt as we learn new information. So with that, I think that what I was hoping to do is, rather than just give you a lecture about coronavirus and those things, is to see what issues are important to you and to your families, and address those. I do have some presentations ready to go if those issues come up, and but I think I'd like to just begin with your questions, if that's all right.
Hi, I have a question. There's a lot of information in the media and things about COVID, but as a parent of an immunosuppressed child, what would you tell our families to really, do we need to take extra precautions? Mm-hmm. Is there something special that we should be doing that we really don't hear out there with the general information that's given out?
Mm-hmm. That's a great question, right? So what am I supposed to do with this, with all this information, and does all that stuff apply to me, and do I have to do more? So I think, honestly, that each family should be assessing what are their circumstances at home, what are the things that they're doing in their life, and then as far as, are there additional risks because of transplant and because of immune suppression, what level of risk is there, kind of based on their child's issue or their own issue. So so there's a lot of unknowns about immunosuppressed people, and particularly transplanted patients and COVID. And in fact, the information that we do know is almost all in adults. So we have even less information about transplanted children and what their level of risk is. But I think that, I do have something prepared, so I'm just going to go to that if you guys don't mind, and I'll just keep talking over it. So here are the things, and can you see the slides okay? Okay. So for, what we know is that people, as far as when I say you should assess your individual scenario, somebody who is just recently transplanted, like in the first 6 months after their transplant, is generally on higher doses or more serious, like, immune suppression than somebody who's many years out from their transplant. So that would be a different level of risk. People who are having rejection may be getting additional immune suppressant medications, and so that will also increase the potential risks of the immune system not being able to handle a virus. We don't really fully know all that information, but I think we should probably assume that the more immune suppressed you are, the higher risk that you have of getting an overwhelming version of the infection with this virus. What we do know about transplant recipients is that they do present a little bit differently. So classically, people with robust immune systems will, almost all of them, 80% or so of people who have symptomatic disease will present with fever. And transplanted people seem to have less fever because their medications are preventing them from producing the little cytokines, which are immune system chemicals that produce fever in the body. And so they also tend to present more with diarrhea than with respiratory. Well, they have respiratory disease, but there's a higher rates of having diarrhea. So diarrhea should potentially be a warning sign for coronavirus in this population. They also get more what's called lymphopenia. So your lymphocytes are one of your white blood cells. And coronavirus seemed in people who get severe coronavirus, it drops their lymphocyte counts quite low, and that is associated with more severe illness. And so transplanted people, because they're taking medications that suppress lymphocytes and they already have low lymphocyte counts, they tend to have even lower white blood cell count or lymphocyte counts than others. There's higher risks of being intubated, higher mortality rate. And now in the studies that have been published, the mortality rate in transplant people was up to 20% of those who acquired COVID. But I have to say that was very early in the pandemic. And one of the biggest studies is actually out of New York City. And I think looking back, I think we can all see that the disease, that the way that we were able to handle the disease in New York City is we've learned a lot since then. So the mortality rate was much higher in New York City than it was as the pandemic has gone on. And in fact, there's some hints that maybe some of the immunosuppressive drugs might actually help to reduce the severity because they are blunting the immune response. So coronavirus disease is not all just virus attacking the lungs or virus attacking the body. It actually is mostly virus inducing a giant immune response that leads, getting a crazy flare, that leads to blood clots and other problems. So I think that there's some hints that perhaps the immune suppressant drugs might actually blunt that response and maybe lead to less severe disease. But honestly, we don't know. The other things to keep in mind is that there are drug interactions between immune suppressants, so tacrolimus, as well as the drugs that are similar to tacrolimus, and some antibiotics and other things that can be used. I know there's been a lot of press about hydroxychloroquine, which has some cardiac side effects, but some of the other medications that are used in transplant patients also have that same cardiac effect. And when you start putting those medications together, that increases the risk of heart effects. So there's a lot of complexities to consider. What we don't know is we have no information at all about how long do people shed this virus who have transplants, and can they get infected again? Because there's simply not enough numbers of people so far to know that. But one could assume that if you don't have a good immune response to clear the virus, you might shed longer than a person who has a good immune system, and that may lead to either more prolonged illness or more prolonged period of being infectious to other people. So that's that. So I think, when you're thinking about like your own personal family, maybe like how, thinking about how crucial is the activity outside of the home, right? Is what you need to do outside of the home important enough that it's worth having some risk? And then as far as extra precautions, I think that there may be circumstances where using a using an N95 mask perhaps makes more sense than using a regular mask. But in general, I think if you really robustly practice just the standard precautions that everybody is being recommended to do, that actually will be quite effective. So I do have some more information about masks. I know that was one of the things that had come up in the previous discussions and in the questions that were fed to me.
Yes, if you don't mind, thank you for talking about the mask. I actually had my son's pulmonary specialist. He said that he should be wearing only the N95 mask. Mm-hmm. He said that because that was the mask that would prevent like more respiratory virus. And he also talked about how we could use a brown bag kind of to put the mask in there to rotate that mask. And then he talked about using like a multi-cooker to sanitize the mask.
Okay.
So those are things that we came across. So if you could tell us, even because, I work at home, but, and I know you said, like going out, taking that risk. But should my husband who's at work be wearing an N95? Right. Should things like that we come across as parents, like, should we all be wearing an N95? Yeah, we just want to know what would be the best or what is correct and what's not correct. And we also heard about some of the cloth masks, it doesn't even help you. There's just so much about masks that is kind of confusing, really confusing.
Sure. So let me first, before I answer that, can I ask you what a multi-cooker is? Is that one of those like microwave / toaster oven like things?
It's like a slow cooker where you would put water, and with the vaporizing and the heat, it's supposed to help disinfect.
Gotcha. Okay. Good. That's actually helpful for me to know. And so did you try the N95?
I actually bought him the N95 and he'll
How did that go?
He'll wear it, but he says it's very, very, very uncomfortable, and he gets like it fits real tight. And then he says he gets marks on his face, and then he says it's really hard to breathe. Like he's having a harder time using it. So right. That's kind of hard too.
Exactly. So this is sort of the issue with the N95. So there are lots of different masks that are available. And so, and there's kind of a spectrum of effectiveness. So I'll go back to this in a second. So, the job of a mask is to stop things from coming through. So particles and air, go through. They also go around the edges of the mask, right? And so really there's the mask serves two purposes. One is to keep droplets that contain viruses from getting out of you into the world, and then the other is to prevent droplets and things from coming into you, right? So there really is it's one device to provide two ways of protection for yourself and for others. So an N95 is a mask that's designed to prevent 95% of particles of a certain size from passing through. So an N95 mask does that when it is properly fitted. And an N95 that's fitted is very tight, very uncomfortable, smells terrible, usually because they're made of, some like weird polymers. And they feel very tight on your face. They're safe. I mean, healthcare workers wear N95 masks for hours and hours and hours on end without affecting their oxygen or things like that. It does make you breathe faster. There's been lots of studies even before COVID looking at, the safety of N95s, and they do make you breathe more shallow and faster. So they're not comfortable, you don't feel comfortable when you're wearing them, but they don't impede your actual like gas exchange significantly enough to cause a problem unless you're already on the brink. So somebody who has a lung transplant might actually be impacted by an N95 because it is trapping some CO2 or carbon dioxide inside For most people, that doesn't make any difference. You still have plenty of oxygen and plenty of gas exchange, but people who are very tenuous, that can be an issue. So the problem is an N95 that's really well fitted will be preventing things from coming in and preventing things from going out very effectively. An N95 that is not well fitted is less effective, right? And so most children are not fitted for N95s, and most random adults are not fitted for N95s. So you have to assume that your N95 is maybe not fully fitted. And so is an N95 going to be better at preventing a vulnerable patient, a vulnerable kid or adult from inhaling a virus particle? Yes. It will be more effective. It's more effective than a surgical mask or a cloth mask. But they're also difficult to wear. And so then we mess with them and we touch them and we take them off because they're uncomfortable. And so the overall effectiveness of using an N95 gets lessened with all of those things. And I think that's actually why there were a lot of mixed messages in the very beginning about using N95s and discouraging people from using masks and discouraging people from using N95s. And it wasn't because N95s weren't going to be effective. It's because N95s are a pain to use if you're not used to using them. And because there was a concern that there would be a shortage, so that the people who were at the front lines who really, really needed an N95 because they were going to be face to face with somebody who was actively infected wouldn't be able to get them. And I have to say that there are shortages. Like I keep hearing things that they go, there's no shortages, but there are shortages. Like an N95, typically, like the standard recommendation is that you use it once with that patient. When you're done, you assume the outside of it is contaminated, you throw it away and you get another one for the next patient. And we're not able to do that in the healthcare system right now. Where are we using our N95s and sanitizing them? So there's not enough N95. So I think that it doesn't mean that you shouldn't have one as the general public. I think it's fine for you to have one, but I think you should know that there are limitations that make them less effective. So then there's other alternatives that I think are, while they may be less effective at preventing virus from going inside your body, they still have some effectiveness. So one are these like N95s or KN95s that have an exhaust port on them. I think there's a picture of one here that I'm highlighting. So that exhaust port allows you to breathe out. It's got a valve on it, so you breathe out freely, but it blocks the additional breathing in. So the mask is filtering, but when you breathe out, you're pushing out, your carbon dioxide and your particles. And so it's more comfortable to wear, but it doesn't protect other people around you. So if part of the mask is if you happen to be infected that you don't want to infect other people, that mask is going to be, it's not going to be totally ineffective at preventing you from spewing out your droplets, but it's less effective. A surgical mask is usually made of layers of material that have a static charge, and so it does trap some particles. So they're slightly more effective well, not slightly, they're more effective than a cloth mask. So a surgical mask generally will keep out anywhere from 30 to 70% of particles. Okay, so it's not 95%, but it's still good. A cloth mask will keep out anywhere from 20 to 50% of particles, so less. Maybe even less depending on the layers. So more layers is better than less layers. Tighter weave is better than looser weave. A single layer of a cloth mask is going to be way less effective than a multi-layer cloth mask, one that is kind of fitted on your face as opposed to sort of loose and baggy. So there's lots of different things. So I think for your personal protection of a vulnerable person, an N95 is absolutely going to be the most effective, but you've got to be able to use it right. And so I think whatever mask you will use properly is actually the mask that's going to work the best for you. Because if you're constantly adjusting it, you're constantly messing with your glasses. If you feel like it's uncomfortable to breathe, so you pull it down below your nose, or you pull it under your chin, or you put it on your forehead for a little period of time, it's not doing anything. So the mask that you'll keep on your face is actually the most effective mask.
I'd like to just ask a quick question. I think that, we hear quite a bit about in about how contagious this disease is compared to things like the flu. And you know, if you watch the media, you get conflicting messages. Has there been enough research done to give us a sense of how contagious this disease really is?
There has been, yeah. Actually, this is, and again, this is one of these things where you see changing information, right? I'm trying to remember if I actually prepared a slide on that. So, I'm just going to look really quickly to see if I have those numbers for you. I do have them verbally, but I don't know if I have them in a picture. Okay. I do not. Okay, so you know, this is one of the things that we kind of figured out relatively quickly in very basic, you know, epidemiologic studies is how transmissible is this virus and how deadly is this virus, right? Because those are kind of the two important things. You can have a virus that's very easily transmitted, like common cold viruses, but they don't really get you that sick, so you know, you don't really care. And then you can have things that are really difficult to transmit, you know, or have a very specific way of transmitting, but are very deadly. And so that would be something different. Then you have something that may have us both, like, you know, measles, which is extremely contagious and potentially dangerous, right? So, so we know that this virus, that how contagious it is varies based on circumstances. So, you know, based on how close people are together, whether somebody is coughing or not coughing, right? So we know that this is actually a pretty contagious virus, a little bit more contagious than the seasonal flu, a little bit less contagious than kind of a lot less contagious than measles, right? And so how many people one person infects around them varies again on their circumstances, but it's usually somewhere we hope that we can get it down to one or less in the early parts of the pandemic, or when we're kind of in a massive surge, you know, it's up to like 5. But in general, people who are infecting 1 to 2 people around them. And then there are some super spreader events where you have one person infecting, you know, 10 people around them because of the area that they're in. So an example was that, you know, choir practice from Washington State, I think, or Oregon, I can't remember, but there was that example was a super spreader event where people were indoors, they were exhaling forcefully because they were singing, and multiple people were infected from one infected person. So the case fatality rate is how we know how deadly something is. So what's the likelihood that when you get an infection that you're going to die, right? So overall, the case fatality rate also depends on medical care and, you know, general nutrition status and everything else. The general case fatality rate currently in the United States, as of October 2020 that I could find, is 2.7%, which is pretty high, right?
It is high.
Right? That means that, you know, 2 to 3% of people who get this infection may die from it. Now that does include a huge surge, right? It's kind of an average. The case fatality rate for a totally normal, healthy person with no underlying conditions is about 0.7%. All right.
Can I ask also, why are we hearing so many dire warnings that the next 6 to 12 weeks might be the worst that we've faced with this? Why are we hearing that? And is it accurate? And what do they mean by this could be the worst that we've faced so far? Because it boggles my mind that it can actually get worse than what it is.
So I think that is true. It's all, I mean, it's prediction and conjecture to some degree, right?
Yeah.
So, I mean, I'll absolutely acknowledge that. And, but I think that, what you have is, that there's a thing that's contagious to other people. And, but that works, if you've got 100 people spreading the contagious thing is different than if you have 1,000 people spreading the contagious thing, right? Because each person is going to infect, let's say, 2 other people, right? So just by, math, you can figure out like how many extra times people are going to become infected, just given numbers of people who currently have it. We know that our cases are on the rise at the moment, right? So in many states, the numbers of people who are infected are increasing. Now, is some of that due to an increase in testing? Possibly. But at this point, we've been doing reasonably robust testing now for a few months. And so I think that you're likely seeing, yes, the actual number of cases are rising for whatever the various factors are. So you simply have, at any given moment, if you're out on the street, a higher percentage of an infected person being around because there's simply more infected people wandering around. Now, the good thing is that we've learned a lot about how to handle this disease. So it's, I can tell you, so I was working in New York City until May of this year. So and so I was there when we were closing down the schools, and it was kind of a big question mark of what was going to happen. And, are we going to have they were having these, refrigerator trucks for the bodies and things like that, right? Like that was scary. Refrigerator trucks for bodies, that's scary. Mass graves, I mean, they were making mass graves, and that's scary. And so that's a place where there's like incredible population density, and this was brand spanking new. And, we hadn't already put all the things in place. We were still really just figuring out how to do it. And people would show up really sick and they would get intubated. And I think we've learned now, like, okay, here's some therapeutics that make this less severe. Here's the things that we should be doing to avoid intubating somebody, because because that's actually bad. Like we don't want to intubate them with this disease. And so, so I think that we've learned a lot about how to deal with it to make it less deadly. But I think that the trend shows that we currently have increasing numbers, and not just increasing total numbers, but increasing incidence rates. So if you adjust the numbers for population, increasing test positivity rates, which means that, the higher your percent positivity on your test rate, it just really means that there's more transmission going on, and not that you're testing more. So because you've adjusted for the numbers of tests that you're doing. So all those things we're seeing are on the rise at the moment for a number of societal factors or viral factors or who knows what factors. It doesn't matter. Whatever the reasons are, it's on the rise. And so I think that, currently, going to the grocery store probably actually has a little bit higher risk than going to the grocery store had a month ago.
Okay. There's a part in the movie Apollo 13 where the flight director asks, well, what do we have on the ship that's good? If the ship is America right now, what as an infectious disease expert, what is, we're at the end of a meeting, and I'm sitting down at the end of the table, and I said, does anybody have any good news? Is there anything that we can just sort of hang our hat on right now and say, you know what, we're going to get through this?
So the thing is, of course, like first of all, we're constantly like innovating and adapting our treatment regimens. For instance, the things that we do to treat somebody who comes in with COVID. I think that even though there's been a lot of complaining about it, I think that we've actually made significant lifestyle adjustments that are overall good for us. Like I think that, washing our hands more and, not going to bars and and wearing masks, in crowded situations. Those are actually healthy behaviors that will serve us well for other diseases, either future pandemics or seasonal flu or whatever. And so I think that we've actually gotten a little bit of perspective about how to be a little bit more, a little bit smarter about our lifestyles. And then, I'm hoping that we are also, that our degree of sort of altruism of how we take care of each other and, kind of approach this as a societal problem and not just my own problem, will, I think that that's kind of taking root. I see that. I mean, I think you see visible, it's very visible to people who are not interested in that. And it's very visible to people who are, really like warriors about it. But most of us are in the middle of that. And I think that, as much as I hear about people complaining about wearing their masks and storming, Capitol buildings with their guns or whatever, not wanting to wear a mask, when I'm around San Antonio, nearly everybody's wearing a mask, right? Now, I have to say that when I was in New York, like 95% of people were wearing masks. There was much more like strict adherence to that because New Yorkers were scared. Like New Yorkers, they were serious. They were like, they kind of pulled it all up like, we're like New York together. We're going to do this together. And they did it, And so, but I think that, we have innovation on our side. We have resources, right? I think that, when things come to treatments and vaccines and medical care, we can do it. I think we just have to have the collective will to do it.
Thank you.
So I do have one other comment actually that I meant to get to on the masks, and I lost track of my brain. So you asked about sanitizing the masks, and so one thing is that it depends on the mask. So an N95 is polymer particles that are woven together and then kind of melded a little bit to create a barrier. And so it's not recommended to get them wet or to fold them, that you'll actually break that barrier. So they shouldn't be disinfected with alcohol or a wipe. You shouldn't get them wet. So the multi-cooker where something gets steamed, it's not an autoclave, first of all, it's just a steamer. So it actually would not be good for an N95. It might actually disrupt the N95. Heat, like putting it in the oven or the microwave, will melt the N95. Plus they have a metal thing for their nose, so that wouldn't be great in the microwave either. And so really it's not recommended to do that. So an N95, you can sterilize using UV light, so like UVC light, or you can wait. So many people are putting them in the paper bag, and the paper bag is really just to keep other people from touching it. There's nothing magical about the paper bag other than the virus doesn't seem to survive on paper very long, and it keeps it isolated. So you essentially put your mask in quarantine, paper quarantine, for a number of days. So how many days that is not set. Some people, I think a minimum of 3 days, probably 7 days makes more sense based on how long it survives on a mask surface. A cloth mask, you can throw in the washing machine and throw it in the dryer, right? So again, thinking about if your doctor says you need to wear an N95 everywhere, you're not going to have a 7-day supply of N95s. Right. And so, but the cloth mask you can easily clean. You can heat up the cloth mask, or you can subject it to UV. And a surgical mask, again, you can't get the surgical mask wet, but you can also subject it to UV lights, which you could do by hanging something in the sun. Like that's the super old school way of doing it. And that's actually quite effective. The sun deactivates coronavirus quite well. Or if you want to be fancy schmancy about it, you can get a UVC disinfection box.
Fancy.
Which we have at home.
Yeah.
Thank you for that information. That's very helpful.
Can I ask you a question that might be a little unfair?
because
Love
it might be a little out of your purview. Is there concern in the medical community that because of coronavirus, people aren't getting, I mean, it's a struggle to get people when they're 50 to go get their colonoscopy anyway, to go get their heart checked, to go get, you know, their wellness check. Is there a concern that that people aren't getting their aren't doing their preventative care, and that may lead to an additional set of problems for you know, midlife folks?
Yes, 100%. So there's a concern about that. So, yeah, so we know that vaccination rates of children are way down, like the routine vaccine rates. That in the first few months of the coronavirus pandemic, I'm going to close this, that people were not going to see the doctor. They weren't going to the emergency room for other things. And so there were like more deaths at home from other preventable causes. Now it's hard to know because coronavirus causes blood clots. So when somebody died of a heart attack or a stroke at home,
yeah,
they actually had coronavirus.
Could have been the coronavirus.
Right? But yeah, absolutely, there's a concern for that. Coronavirus has delayed transplants, right? Because people,
yes, it is.
Right? People aren't, you know, their clinics aren't running fully to capacity. You know, when things that are not that a transplant it is exactly elective, but there is sort of an elective nature to, let's say, a live donor going in, right? And so, because why would they go into the hospital system?
Respiratory doctor having to fly to be with the organs. Yeah.
That's right. And you actually have, there's been a significant impact on the medical workforce. A sizable percentage of coronavirus cases have been in healthcare personnel, right? And that, and deaths as well in healthcare personnel. And so that impacts, you know, the availability of staffing when you lose a percentage of your workforce. So, and because it's just sort of the nature of the job, like you go to work every day and you get exposed, and that just comes with the job. And so, yeah, there have absolutely been, there's totally concerns that people aren't getting their routine stuff. And for instance, just to use a personal example, I haven't been to the dentist. So like, I like to go to the dentist. I like to get my teeth cleaned. There is no way that I'm going in an enclosed space with my mouth wide open and another person hovering right over me right now. And unless they do some robotic dentistry from the other room, like it's not like my teeth are fine. I don't have an emergency issue. They're just going to be dirty for now. You know, so yeah, people are foregoing their maintenance procedures.
As an organization, our biggest concern and focus at Transplants for Children is to really help assist and guide young people through that transition from pediatric care to adult-based care. And so I'm thinking, you know, it's not like these young kids need an excuse not to go to their clinic.
Right.
But now there is one, actually, you know. Yeah. I don't want to go up to the hospital. No. I don't want to get coronavirus. I'm not going to go to my clinic. I'm not going to get my blood work done. I'm not going to get my x-ray done, or so on and so forth. So
you are correct. So
that's worrisome.
It's very worrisome. It's very worrisome. And so it's kind of why we need to, you know, we need to think about, I think, you know, not just, you know, how do we wait for this to get by so that then we get back to normal? Like I don't think we should be thinking about how do we get back to whatever we were doing before. I think we need to be smart and adapt and figure out how do we get around this and still do the things we need to do while this is here, because it might be here a little while.
Well, speaking person in their 50s and a male, you don't have to give a male much reason not to go see the doctor. You don't need to give a middle-aged male much of a reason not to go get their colonoscopy at 50. And I'm all taken care of. But I do worry that that there are secondary. Obviously, there's mental health challenges that are going to come from this for all of us in one way or another. But then there's that tertiary of people not going to the dentist, not getting, their heart checked when they should, kids having an excuse, or kids, I call them kids, young adults, not going to their transplant clinic and not effectively making this transition. Well, that these tertiary issues are going to be just as bad, if not worse.
That's true. And young adults not going to get their contraception and unintended pregnancies, which is that's what I was doing adolescent medicine in New York. And we actually never stopped working. We never closed our clinic. But we definitely saw an increase in unintended pregnancies because of people not feeling safe coming in to get their birth control. And what we had to do is we had to adapt some of our systems. Like normally I wouldn't do Plan B as a phone consult, right? I would require to see you in person and watch you swallow the pill. And but talking to somebody and figuring out how can we get them whatever the thing is that they need in a different way. I had a kid who had an asthma exacerbation and literally had got an inhaler out of the dispensary at the pharmacy and carried it to meet him on the corner where his apartment building was to say, okay, here's your inhaler. Now go back in, because he, we couldn't accommodate him in clinic at that moment, but we wanted to be sure that he got his medications. So I think that, the healthcare system has adjusted by including way more telemedicine than we used to do, which I think is good. And I think patients like telemedicine because again, you can be in your pajamas and get a lot of the stuff done as far as, are you taking your medicines and, checking on blood pressures or whatever, if they have a machine at home. We can adapt those things. The only reason we haven't done telemedicine in the past is because it's not paid for. Insurance companies don't pay for a telemedicine visit, so doctors don't do a telemedicine visit. Emergency authorization, suddenly insurance companies are paying for it, and now we can do it, And so I think that, again, thinking, how do we adjust our system so that we don't lose track of exactly the things that you're talking about? The dentist, I don't know how they're going to get to my teeth, but those other things, how can you, how necessary is it to get those labs at that frequency? When do we absolutely have to get them done? What are the steps that the system is taking? I think you see it when you go to the doctor. You see the waiting rooms have changed. Suddenly you have appointments for everything instead of you're just going to walk in and take care of something. You have to think ahead and make appointments for everything these days. That's okay.
Okay.
If you have to make an appointment to go to the DMV to get your driver's license, that's okay. If you have to make an appointment to get your blood instead of just walk in whenever you feel like it, I think that's okay. And then maybe you have less of a crowd there to confront you. And you
beat standing in line.
Mm-hmm. But you're right. I don't know how you're going to get the middle-aged man to go get his colonoscopy or the woman to go get her mammogram, because there's a lot of psychological disincentives to doing that.
Yeah. Well, there's an excuse not to.
Yeah, exactly.
It was already hard enough.
maybe like they have these things where like the bars could open if they had like 51% of their revenues
That's right.
from food. Maybe it needs to be that 51% of their revenues are from colonoscopies.
You have to show your colonoscopy card to go into a restaurant.
I have a question. Well, because we have a lot of moms with little ones too. It's kind of scary, to take your kids anywhere. Holidays are coming, Halloween, Thanksgiving, Christmas. I mean, we don't want our kids out there because we don't know, we're afraid for our kids to get sick or whatever. And there's a lot of myths too. Like I hear, oh, you should be taking this vitamin, or what, you should try drinking hot fluids because they're going to help you if you have lemon and hot water. Is there anywhere any of this is true? It's not. You shouldn't be doing this. I mean, what would be the best advice you could give to us for things like that?
Okay. I'm going to show you a presentation. I'm going to show you two presentations in a row to kind of answer that. So this is really like, how do you choose what things you do, what things you don't do, and what's up with vitamin D, right? Because I know that, and I'll do that one first, I think. Okay, can you guys see that? Okay, so there's actually been a lot of press about supplements and things like that, and which is true for any medical condition, and it's almost impossible to separate what's snake oil that's completely ineffective, what's essential oil, what's actual real stuff, and so the things that we know a little bit about and that we have some information about. So one is vitamin D. So very early on, it was reported that in observations of people who had this disease, that people who had vitamin D deficiency before they contracted COVID had a higher rate of getting infected and had a higher chance of getting in the ICU. So, so vitamin D deficiency has been as an association or potentially a risk factor for contracting this disease. Now, there's no evidence of using vitamin D as treatment for COVID. There's just this association with more severe disease or more risk of getting infected with being deficient. So, so it is worth, I think, for people who are vitamin D deficient, becoming not vitamin D deficient during this time. So, and a lot of transplant people are vitamin D deficient, either because of medications, because of their own inherent problems, especially if they have, kidney disease, or because they don't, if they're relatively fragile, they're not outside very much, because really how you get vitamin D in the most effective form is from being in the sunshine and letting your own body create it, using the sun. So, so it's probably worth people being on a vitamin D supplement to be sure that they have normal vitamin D levels. And again, go in to get your vitamin D level checked so that you know whether or not that's yet another medication that you have to add to your, gigantic list of medications or not. Okay. And getting some exercise outside is probably a good idea anyway. And so getting a little bit of sun to enhance your vitamin D levels. So it's worthwhile, especially anybody who has an underlying medical condition, probably should have their vitamin D level checked to make sure that whether or not they need to be on vitamin D supplementation. Vitamin C. So we know that vitamin C it's not really a question that's has some immune system benefits. So there have been, I only pulled the first page of already published studies about coronavirus and vitamin C. And so people have been crazy about looking at vitamin C. And the take-home message of this is that we know that vitamin C is an antioxidant that helps the immune system. So stuff that helps your immune system generally is going to help you avoid illnesses. There have been a few cases of reporting using a high dose IV vitamin C for people as a COVID-19 treatment with some benefit, but they are cases without controls. It's not a broad study. It's like, I gave this patient this and they got better. Would they have gotten better without the vitamin C? Maybe, maybe not. You don't know. So there are currently, I think, 13 clinical trials looking at vitamin C for treatments. Generally, vitamin C is relatively benign. It's not usually a very harmful medication. It doesn't have a lot of drug interactions. Usually if you overdose on vitamin C, you mostly have vitamin C enriched urine as a side effect. And so it doesn't usually have that many side effects. It's probably a good idea to be on some vitamin C. Okay. But is it necessary? No. Is it actually helpful? We don't know. Zinc is the other one that's been looked at a lot. So zinc is also one of these minerals that has long been associated with improving immune system. And there are actual clinical trials that show that zinc improves diarrhea outcomes in the developing world in children with diarrhea, that zinc reduces the duration of respiratory illnesses, like regular common cold respiratory illnesses. So we know that zinc can have some benefits, but zinc is not perfect. So zinc really needs to be at the right level, because you can have a zinc deficiency and then you get an immune deficiency, but you can also have, if you have too much zinc, you also put your immune system at a disadvantage by affecting some of the T cell functions and the cytokine production. And so zinc generally can benefit the immune system, but it can be harmful. And it has lots of drug interactions. So it interacts with ACE inhibitors, which is a blood pressure medication that many kidney transplant patients are taking. And it can interact with some antibiotics, and it interacts with calcium. And so I think zinc is something that I would honestly check with your physician before taking it as a routine supplement. Unlike vitamin C, which is probably no big deal. And then as far as, your kids wanting to do stuff, right? And how do you manage yourself during this time? Like, what other stuff, what can you do? What can't you do? The holidays are coming. What does that look like? So just as a reminder that coronavirus is spread primarily through droplets. So droplets are little blobs of like mucus, microscopic blobs of mucus that can contain viruses, and you breathe them out, you cough them out, you sneeze them out. Most of them fall quickly onto a surface within a few feet of you. Aerosols are smaller blobs, and those float out farther and remain in the air. So you know that you can get large droplets, you can get small droplets. The size of the droplets travel different distances, and this is where this magical 6-foot distance comes from, is what size droplets do most people put out and how far do they generally travel. So we know that the most coronavirus infections are transmitted through small droplets, large and small droplets, some through aerosols, some through what are called fomites or surfaces, but primarily through droplets. You can get them from touching things that other people touched, or from person to person or hand to hand contact, because then you also touch your face. So things that increase the risk are things like touching your face, people who are breathing hard or breathing out more particles, touching things that other people touch, being close to other people indoors, we know is an independent risk factor for transmitting this virus, being around people who are coughing or sneezing, and having an uncovered face, right, increases your risk. So one person with a covered face decreases the transmission, 2 people with a covered face decreases the transmission even more. And I like to think of those things as kind of cumulative, right? So if you're indoors, you have a certain level of risk. If you're indoors and somebody's coughing or sneezing, that's a higher risk. And so you can add those risks together to determine how risky is a particular activity. So ventilation makes a difference. So having open windows helps some of the particles to escape. And of course, outside activities are safer than inside activities, because most of the particles just float away and nobody ever breathes them in, and they become, if it's sunny outside, they become deactivated by the sun. So you want to avoid crowded spaces. You guys know these things, right? Like you've been told these things 1,000 times. There's been studies looking at the CDC. It wasn't a huge study, and it was fairly early on, but they looked at people who were infected and people who weren't infected and what were the activities that they were doing. And the one thing that fell out for everybody, regardless of whether they had a known coronavirus contact, was going to a restaurant. So, so going to a restaurant is a risky activity, right? Or things that look like going to a restaurant. Maybe that means, going to a large family gathering indoors like Thanksgiving, where everybody's faces are uncovered because you're stuffing it full of pumpkin pie, and talking in an indoor space, right? Bars, coffee shops, churches, religious gatherings in the gym, those were all the things that had a higher risk of getting infected. Clearly staying away from people who are, breathing hard, because a sneeze will push those particles way farther than just regular breathing. Don't touch things that other people touch. That also is kind of common sense. I think we've all known that from first grade. And so we're discouraging handshaking. We really shouldn't, even fist bumping is a hand-to-hand contact. High fives are a hand-to-hand contact. We probably shouldn't do that. I think we need to all adopt the sort of Asian, bow as a way of being very polite to say thank you and please and our disagreement, or whatever other signals that we want to use that don't involve touching another person. And then of course, washing our hands. And then the big one is not touching your face. So this is hard for me. So the metrics that I found is that we touch our faces 23 times an hour. I think the little video that I had for you is that there's 16 times an hour, which I probably won't play. And that's, just like sitting here, like doing this, or doing this, or it doesn't have to be like, rubbing your nose. It's just like sitting around and you touch your face. And so I guarantee that multiple ones of us on this call have touched, if we went back through the footage, that one of us has touched our face in the last minute. So I don't know why it's not advancing. Oh yeah. So biting your fingernails. I chewed off one of my fingernails today, so I clearly didn't obey my own advice. So biting your fingernails, and then this, right? So I think a good practice when you are doing anything out in the world, you're getting on the elevator and or you're checking the avocados at the grocery store, is that you should assume that this kid was the last person to touch the thing that you're touching, and be mindful of where your hands go, because this kid's hands were just there.
Thank you. That was good information. It makes me feel better because sometimes I'm very, protective maybe as a parent, or I don't go to certain activities that my family, and at home it's just 3 of us. So family, that means going out of town, and that's separate. So I don't do a lot of these events. And sometimes as a parent, I feel guilty, or am I holding back my child from not spending time with family? So it's hard, but that's why I wanted this information, because to me it's like, okay, I'm doing the right thing. I'm not crazy. I'm doing what's best for my son,
It is hard. It is hard. But again, like every circumstance is a little bit different, right? Every family is a little bit different. And people shouldn't be like living in fear or whatever, but I think people need to be smart about what they're doing, right? Like if your child goes somewhere and they get infected, let's say like other children, they're not that ill, right? Because children don't seem to get generally as severely ill as adults do, but that they're still contagious. If they're transmitting to others, are they then going to give it to grandma? Are they going to give it to another transplant kid that they're sitting next to in the clinic? If somebody is a single parent, or there's only a couple of caregivers, if one of you gets in the hospital, like who's looking after the transplanted person if the caregiver is in the hospital? So it's not that people need to be like walking on eggshells or afraid, but I think people need to understand that there is a risk to activities. And on the super safe spectrum is locking yourself in your home with no other human. But that's not feasible for our lives, right? Like we can't do that and remain sane to go into just like personal solitary confinement for a year, right? That's not a happy place. But also like, running around at, going to a concert without a mask on because you want to be free, like that's also not smart, right? That's the opposite end of the safety spectrum, and that's not smart. But I think that, thinking about like, okay, here's the things that we want to do, here's the stuff that's on our plate, is going to Thanksgiving, where everybody's inside and they're not wearing their masks and they can't help but hug each other. Is that truly safe in this scenario? What if it's outside, or what if it's a smaller gathering? If it's like something that's a buffet that everybody's like touching the same utensil as it gets passed around, that's probably not a great idea, but having one person serve everything is a little safer. So you're just thinking about like, okay, what is it going to look like? And is that something that's a level of risk for me? We don't know about transplant, kids or adults that much, but we assume, it looks like they potentially have they're a higher risk for more severe disease. And so keeping that in mind is probably wise.
So it seems like though we're learning more and more about the coronavirus and what it does, what we're doing right now to protect ourselves, that it seems like what we've been doing is still a good way to go with protecting yourself. Is that correct? And then continuing with distancing and wearing your masks and things like that should probably be our best way to protect ourselves. So what do you see that holds for the future in terms of the outcome of all of what we're experiencing with coronavirus?
Well, I think, the good thing is that this isn't going to be forever. Like this thing's not forever. So it might be around with like some version of this virus is likely to be around with us forever at some level. Hopefully similar to, the seasonal flu or other viruses that we have to deal with. Right. And that's what that's going to take, is that's going to take a combination of enough people with immunity to it, that it's not as contagious because there's simply people can't get infected because they're already immune. And that's really going to be the key. Or the virus itself mutates and changes in a good way to make it, where it just becomes less virulent. And that certainly can happen as well. So, it's the nature of a viral illness that it's not going to be forever. And that our immune systems collectively will manage to deal with it over time. Ideally, you'd like to see that happen in a way that doesn't involve a bunch of people getting sick, right? So ideally, you'd like to see that happen in a safe way of getting immune, which would be through a vaccine, as opposed to natural immunity, just because the case fatality rate is high enough that I think making natural immunity a little bit of an irresponsible approach, so I think that we will get through this. And are we, like I said before, I don't know that we're going to go back to however things were in 2019. And I don't think we should go back to how things were in 2019. I think we should plan for, a slightly different looking future that has maybe a little bit less surface contamination than our old ways had, right? Like I think that we can do that in ways that are beneficial to our society, right? Like I could say like the number of delivery people has increased, right? So that's good for employment. And so there's, I think that things aren't going to be dire. And honestly, I don't think that things actually are that dire right now. I think we're just getting used to things being different than how they felt before.
Well, thank you, Dr. Barton. Does anyone else have any questions?
Travis is so quiet.
Well, thank you so much for taking the time to share that with us, and you, your advice and your expertise will certainly help our families. And I want to thank you for being with us here today.
Well, I'm happy to be here, and I'm happy, to answer questions on an ongoing basis as they
Wonderful.
come up, so.
Thank you so much.
Yeah.
And one of my many takeaways. Thank you.
Thank you.
Thank you.
It's funny. So before I went to New York, I lived for a year in Laos, and it just became second nature that, like, everything, like, you finish paying at the store and you just give like a quick little bow. And it was so, like, I was like, once you do it, it's so easy and it's so polite, and it's very sanitary.
Yeah.
So, yeah.
Yeah, I think I'm going to adopt that today. So
Yeah.
I know.
Thank you.
Thank you. Thank you so
All right.
much.
Thank you.